Longer treatment of ultrasound can stimulate the differentiation of fibrocytes into fibroblasts. This is a study done showing the effects of LDM ultrasound on HSP or heat shock protein expression, and it shows significant increase after exposure to ultrasound energy and postulated the mechanism to be the pressure gradient. Again, this is a physical, not a biochemical etiology over the cell membrane, influencing the cell shape and cytoskeleton. Heat shock proteins are a family of proteins that are produced by cells in response to exposure to stressful conditions, and they're thought to be involved in various signal transduction processes. Activation of the heat shock response via HSPs normally results in cytoprotection, and they were found to be suppressed in aging skin and diabetes patients. Ultrasound can also create movement of fluids along cell membrane boundaries via oscillations of mechanical pressure in tissue. This is called acoustic microstreaming. And this can alter the membrane structure, function, and permeability of cell membranes, and even the extracellular matrix. In this article from 2012, they showed that cells produce significantly more collagen and GAGs after ultrasound exposure. And the upper picture is the control, with the lower picture here showing more GAGs surrounding the cells exposed to ultrasound. Just last April, a paper on ECM rigidity, which is closely related to how skin boosters like Redron or polynucleotides function and its effect on sonoporation. And it focuses on the microbubble dynamics. On the left, you can see the different types of microbubbles and their interaction with the cell membrane. And they used a high-speed camera to measure the microbubble sizes and dynamics in soft and rigid ECM environments. To me, this was a real eye-opener in the sense that I didn't know there were these types of different interactions happening on the cellular level during ultrasound treatments. And seeing how substrate rigidity can influence the ultrasound bubble mechanics, it opens up so many more questions and possibilities when it comes to combination treatments with HIFU. And this article concluded and emphasized the need to understand physical mechanisms, especially cavitation in HIFU and ultrasound treatments. They gave the example of lithotripsy and stating the avoidance of cavitation effects on tissue is probably why there's been little change or breakthrough in HIFU treatments. That is until now that we have linear HIFU available. And the reason for me sharing all of this up to now is to convey that there's so much more than just the thermal heat from HIFU that is going on in the tissue. What has been the major breakthroughs in HIFU technology and HIFU clinical effects over the last years? Patient expectations have been growing exponentially, but our HIFU technology has been stagnant. There's more to HIFU energy, especially in the acoustic cavitation realm, but maybe we're just ignoring it because, well, it's very complicated and difficult to understand. So I apologize for the lengthy prelude, but because some may say there is little evidence published on linear HIFU, I wanted to present some background on the potential that linear HIFU energy possesses to improve the areas treated through acoustic cavitation and nonlinear absorption. These are two books that some of the information that I shared just now is from, and I'm still studying them, but it's not easy. I hope that we can study more together in this field and discover more breakthroughs for HIFU treatments in the future. On to HIFU. We all know what HIFU is, high intensity focused ultrasound, and I'm sure you know a lot about the mechanism and how it works already. And we've seen this slides too many times, so I'm just going to skip this. After HIFU, we know that the intensity zones of heat initiate wound healing processes in those areas. And there are two different types of HIFU energy delivery modes. But until now, we have only had the first mode to use in our practice, sequential discrete mode. Is a type of HIFU we're all familiar with. When the HIFU fires a series of separate TCPs, whereas a continuous scanning mode fires energy in a predetermined trajectory. So for ease of communication, I'll refer to them as dot and linear HIFU. For myself, I did not even know there was this type of scanning HIFU energy, and I also thought that it was a very recent development, but doing some studying, as you can see here, even in the early 80s, 1980s, there were papers on this type of linear ultrasound energy. Here on the left is the dot type HIFU we know about, and on the right is the linear type of HIFU. And actually for some time, we've had this linear HIFU for body lipolysis, but as many will know, it's very painful. So we need to balance the effectiveness with the pain level and side effects. Now, this is a very important paper that I feel forms a basis basis of understanding the two different types of HIFU energy and how they differ. Now, this slide refers to the dot HIFU. This is the x-axis, and this is the z-axis. The z-axis meaning we're looking at it from above. So we're looking at the width. In dot HIFU, as the interval space is decreased as we go this way, the width increases and starts to overlap. So you can see that there is a fluctuation here in the peak temperature, and this suggests more interaction between points when the interval space becomes smaller. So you can achieve smoother lesion boundaries by reducing the interval space, but you will experience higher peak temperature and more fluctuation. Now, this is linear HIFU. This shows the difference in lesions when the speed increases. You can see the smooth boundaries along the scanning path and reduced fluctuations in the temperature profile. Efficiency of the continuous scanning mode becomes higher with a lower peak temperature than dot HIFU. And interesting enough, in the conclusion of this remarkable paper, they state that there is a need for better understanding of relationship between heating and bubble dynamics, which is a repeating challenge from these ultrasound experts. Now on to Ultracell Q+. The name of the HIFU device, which has linear HIFU cartridges, is called Ultracell Q+. Linear firm refers to the treatment using the linear cartridges. There are multiple cartridges for face and body treatments. The dot cartridges are called Q, and the linear cartridges are just called linear. There are cartridges that can be used on the face and the neck. There are cartridges for the body, which have deeper target depths. And all the cartridges have beveled tips, which makes visualization of the area being treated much easier, which is important for accurate and precise technique. And pain with these cartridges are much less than with other HIFU devices. I've used 2 other devices previously. And even with numbing cream, I find that, even without numbing cream, I found that the dot HIFU has pain less than 5, and for linear HIFU, less than 4 in the majority of patients. So in my patients, I do not use numbing cream when I perform the procedure. And many patients ask, why is this less painful than with other HIFU devices? And one of the reasons may be related to the speed of the line being produced. It is known that this machine is faster than other HIFU machines, which can be an advantage for logistical reasons, but clinically, the fact that the speed can lessen the pain is of greater importance. Okay, here we can see that the linear HIFU has a much faster speed per shot. This is the Athera Ultraformer. This is the Q dot of the Ultracell Q+, and last will be the linear. Yeah. So now you might think that being fast is not important, but other than being less painful, we cannot ignore the fact that as physicians, we're human and with limited stamina and concentration. If you are doing 800 to 1,000 shots at 2 to 3 millimeter intervals and it's taking 1 to 2 hours, you will be more prone to make mistakes. With Ultracell Q+, I can do 1,000 shots in 30 minutes. The dot HIFU is a typical HIFU energy, which is used for tightening and lifting with temperature rising to 65 degrees, while the linear HIFU has a temperature of about 58 degrees and can be used for bulk heating, fat lipolysis, and pigmentation flushing reduction. Here you can see the pattern of the TCPs in a phantom medium and on a slide at the bottom comparing between the dot and the linear HIFU. And going deeper in comparing the dot and the linear HIFU, knowing that the energy or joules is a multiplication of power or watt and time, let's assume the same joule energy. With the linear type HIFU, the thermal zone has a shorter on time for the same line compared to the dot HIFU, which allows a higher power or wattage, which can provide better clinical results. And since the area of energy delivery is larger for the linear HIFU, assuming again the same joule energy, the fluence is relatively smaller, which can reduce the pain felt by the patient. Here you can see the actual difference in the area of the 2 different HIFU energies, dot on the left, linear on the right. And for the linear cartridges, we can see that 58 degrees and above is maintained for more than 2 seconds, which in turn produces lipolytic effects. And we know that cell death can occur above 56 degrees if maintained for more than 1 second. This is the graphic user interface. Usually I pay more attention to the current shots, the power, and the auto mode settings. I shortened the length of the line if I'm treating curved TIZs, but there was not a single device that was dominant in the analysis. And in addition, interesting enough, it was observed that there are areas above the targeted TIZ areas, which are here. You can see some tissue coagulation where the arrows are. So the question arises whether this happens in vivo human skin, and if so, does it lead to skin rejuvenation or not? It is important to remember that energy can accumulate more than we think in layers above the targeted depth due to this nonlinear and acoustic cavitation energy, which I explained earlier. In this white paper done by Dr. Nonak Young, 30 patients were studied using the 2mm and the 4.5mm linear transducers for the lower face and double chin areas. An average of 523 lines were shot, and sessions were 4 to 6 week intervals. And the results showed a clear improvement in sagging skin, elasticity, fine wrinkles, texture, and tone. It was found that 3 sessions compared to 1 or 2 sessions were favorable, and higher energy with more lines, especially for fat areas, showed better results. In this white paper by Dr. Lee Jae-hyuk, he performed 2 sessions every 1 to 2 weeks using the 2 and 4.5 millimeter linear transducers, and the results showed brightening in the skin and increased skin elasticity for all patients in the 2mm group, and all patients showed significant improvement in double chin contour and volume reduction in the 4.5 mm group. This paper showed how HIFU can potentially be a modality to treat pigmentations and was carried out in guinea pig skin. Group 1 is a control with no ultraviolet radiation and no HIFU. Group 2 has a control with ultraviolet radiation but no HIFU. Group 3 is the ultraviolet radiation treated with HIFU at a lower energy. And Group 4 is treated at a higher energy. You can see the reduction in pigmentations after 2 weeks and more evident in the higher energy group at 3 weeks compared to the lower energy. Similar results in the dermoscopic pictures, and you can see in the histology slides for Group 4 also less melanin. The article stated that the mechanism underlying the lightening effects of HIFU was not totally understood. It was proposed that the mechanical destructive effects, induced vibration and friction, eliminated the melanin and pigmented debris similar to fractional lasers. The study from 2017 was done in 20 human subjects of Fitzpatrick skin type 3 and 4, which are the main skin types we deal with here in Asia, and the pigmentations were induced on the arm and were randomly assigned to control or HIFU treatment. Fitz type 3 subjects had less improvement than type 4 subjects, and it was hypothesized that in type 4 subjects, the melanin deposition tended to be more dispersed throughout the skin compared to type 3 as a reason for the better results after HIFU. All of the type 4 subjects had higher degree of improvement in HIFU-treated sites than the control sites in objective and subjective assessments. And you can see here the improvement of melanin at the lower epidermis layer after 4 weeks compared to the control. And yeah, we discussed about this before, so I'll just pass. What about the effects of HIFU on rosacea patients? This paper was published in 2019 and studied the effects of HIFU on 88 human rosacea patients. Assessment was done long-term, up to 1 year. And the results showed improvement after HIFU in most of the assessments. Mechanism explaining as the TCP is coagulating the blood vessels in the superficial plexus, reducing blood flow, and repairing the damaged skin barrier and changing the Demodex environment. And to dive a bit deeper on how HIFU, especially linear HIFU, can improve on skin erythema, we can start with this study, which applied HIFU to a rat artery and showed a positive correlation between the HIFU energy and blood vessel damage. And as the energy increased, there was a reduction in vessel diameter, then occlusion of the blood flow, and then rupture of the blood vessel. As mentioned earlier, acoustic cavitation occurs, leading to oscillating bubbles, which can be stable or inertial, leading to collagen contracture of the outer layers, or direct energy on the vascular wall, leading to constriction or occlusion. Ideally, we will want non-occlusive changes, which would require temperature more than 43, yet less than 64 degrees Celsius. And this raw data from the principle on the 2mm linear transducer showing that the temperature is maintained from the 43 to 58 degrees range, which can lead to contraction of small vessels in the dermal layers. This is a 34-year-old female patient of Dr. Lee in Korea with rosacea and telangiectasia. She suffered from frequent hot flushes, dryness, and burning sensations. Total of 3 sessions were done. You can see the improvement in her cheek area erythema. Different filter to see the improvement a bit clearer. Patients subjectively assessed that her dryness, hot flushes, and skin elasticity improved. Another case of improvement of erythema after using the 2mm linear HIFU treatment. An improvement of telangiectasia after using the 2mm linear HIFU. Going on to, clinical applications. Most of these indications are already well known for traditional HIFU, but with a new linear HIFU, we're able to address additional conditions such as fat reduction, facial and neck asymmetry, which is due to soft tissue, hyperpigmentations, and even rosacea and flushing. I think it's very important and essential to assess the areas of concern that the patient has and determine whether it can be addressed by this treatment. If you're not both on the same page, there can be a conflict after the treatment when the patient does not see results on what he or she thought would occur. Always check the medical history, any significant topical products or oral medication, and lastly, if they have any dental conditions, especially implants, which can cause more pain when treating in the perioral areas. I always explain to my patients that there can be lifting, but that HIFU effects are more to produce firming and tightening of the face and neck layers, which is multi-directional in vector, and that we are trying to prevent sagging as time goes on. If you can prevent sagging and maintain what they have for 5 years, 5 years later, they can look 5 years younger than those who just age naturally. Of course, this is a general statement just to explain to the patient the concept. One of the most important factors is to assess the facial shape and morphology. This will affect which depths and energy you will treat at. Check and see the skin hydration and elasticity. If the skin is too dry, I would hydrate the skin first with other treatments before doing HIFU. And make sure you know if the skin is sensitive. If so, take precaution in those areas. Otherwise, you can cause unwanted side effects. So now let's look at the dart cartridges or the Q dart transducers. For 4.5 mm dot, I only use it sparingly on the lateral neck and lateral face. 3 mm dot is a workhorse and is very safe and versatile. If a patient has very little fat, hollow cheeks, and concerned about fat loss, I would skip the 4.5 and just start with the 3 mm. On the cheeks again, if I use 4.5 mm I use 4.5 for the lateral aspects only. 3 mm can be done on most of the neck and cheek areas, but I usually avoid the very close to the perioral areas unless they have thicker skin and more fat. For the nasolabial folds, I use the 3 mm for deeper treatment with more lines using the 2 mm dot. Since the 2 mm dart cartridge has a smaller head, which allows more accurate placement in the NLF area, I place the lines parallel and perpendicular to the nasolabial fold. But you need to be careful about the pain in the maxilla areas if the patient has tooth implants or sensitive teeth. So I always ask the patient if they have any history of tooth implants. For the periorbital area, similar to the nasolabial fold, I use a 3 mm for deeper treatment on the temples, but I use more of the 2 mm dot in a radial pattern around the eyes. Again, the smaller head of the 2 mm allows for more accurate and safer treatment around the eyes. You can see that the skin is roughly 2 mm thick, which is ideal for the 2 mm transducer. This is the 2.0 mm dot QS transducer, and you can see that the size and shape is more suitable for treating tighter areas like the perioral and the periorbital areas. So when using the QS 2 mm cartridge, it's very important to protect the eye. Our target is the skin around the eye and not the eye. So you always have to have a habit of palpitating and feeling for the orbital rim. And if you need to, you can mark it out. You can also pull down the skin with your finger, or you can also use the transducer to pull down the skin and angle downwards instead of upwards to be more safe. So this is an example of what you can do, pulling down the skin and using the transducer and angle it downwards. For the forehead, I personally use the 2 mm due to the higher probability of striations and due to the curvature of the forehead. I think it's important to lower the energy 0.1 or 0.2 more than what you were using on the other parts of the face. If the patient has more severe wrinkles on the forehead, you can add on the Q 1.5 mm. Now onto the novel linear cartridges, which are currently available mostly in the 4.5 and the 2 mm. The linear 3.0 just came out. Double chin treatment is really where the linear HIFU has an important niche. In a context like Singapore, and maybe in your country where injectable lipolysis treatments are not permitted, or where patients are not keen on invasive methods, this non-invasive method of reducing fat in submandibular, submental, and lower cheek areas is game-changing. I usually use the 4.5 linear the most, but in cases where the fat is thicker, and you can use a caliper to check, you can use the 6 mm also. I usually keep the lines about 2 to 3 millimeters apart and treat with a total of about 400 shots. If the patient also has skin laxity, I also add on the Q3 mm and or the Q2 mm and do the treatment every 2 weeks for 3 to 4 sessions. And here are some before and after pictures. So I appreciate if you don't screenshot. These are the patients. This is first case of double chin after 3 sessions of linear HIFU. Case 2, also double chin. After this patient took about 6 sessions. So after 3 sessions, it's not always very noticeable or visible. Sometimes you have to do more than 3 sessions. This is another case from the principal. This was 2 sessions using the 6 millimeter linear, 4.5 millimeter linear. Case 4, also 2 sessions afterwards. This case 5, one of my patients, I know the angle is not ideal. I apologize for that. Maybe you can notice the difference in the jawline definition. The patient is very satisfied and notices it. Is very happy with the treatment. Another patient, after 3 sessions, also seeing more definition in the jawline and the submental fat. Same patient, other side. For the nasolabial fold, mainly it's recommended to use the linear 3.0. I think this is to be researched and we have to wait and see. I just received 3 millimeter linear recently, so I'm testing it out right now. But the principal claims that it has a high potential for treating areas like the nasolabial fold and the marionette lines. For the 2 mm linear, I use it for all areas, usually treated with the HIFU, so the neck, cheeks, temples, but I don't use it on the forehead because you cannot adjust the length of the line, which on the forehead contour can be risky. So with the dot cartridges, as you know, you can adjust just the length of the line you're using, but for the linear, you cannot. It's 25 mm and set. Combination treatments can use with LDM ultrasound, botulinum toxin, polynucleotide, filler, skin boosters, different lasers. These are some before and after pictures to do on the body for the upper arm, for love handles, the flank, also for inner thigh, even above the knee. I don't think there are any absolute contraindications for HIFU, maybe pregnancy and breastfeeding, but for relative contraindications, I'd be careful about doing it in patients who are elderly and have very severe skin laxity. They're not going to see much difference. Active acne, if they're currently on isotretinoin, using hydroquinone, if they have severe rosacea or eczema, severe sun damage, recent unknown filler injections, it's still a question mark whether this will affect, whether the HIFU will affect the longevity of the filler that's injected or not. I think the most important thing is when the patient has unrealistic expectations, this is a relative contraindications. You really have to be on the same page before you do the treatment. Side effects and complications are very rare. Of course, they can have some pain, can have some erythema, edema, loss of fat. Remember, you have to communicate with the patient about whether they want to lose fat or not. Striations, blisters, burns, neuropraxia, bruise, these are all very rare side effects. There is this interesting paper with a case series of 5 patients, and they did a review of literature. And these are very unique and rare cases of severe complications, which most of us have never seen and hopefully will never see. But it's important and necessary to inform the patient of the worst case scenarios before the treatment. And also this is related to the need for sufficient understanding, selection, parameters of the different transducers. So you have to have enough patience and proper technique to reduce these risks. When you know you have a long procedure ahead of you and you start to rush, that is when complications can arise. So the fact that this HIFU has a faster shooting time and shortens your treatment time can actually help to reduce your risk of side effects indirectly. The main side effects in this review from this paper were wheals and welts, but please check this paper out if you have the time. It's very informative. We're familiar with this type of diagrams on what areas to avoid, but actually you can still treat some of these areas as long as you regulate the energy and use shallower depth of transducer like the 1.5 or the 2 mm. These are some examples of striations courtesy of Dr. Lee Charu in Seoul using the 2 mm transducer at 3 joules 1.5 mm interval. If you see these, don't be alarmed. Most will subside. It's riskier if it's on the neck. You can prescribe a mild topical steroid to apply for a few days and it should improve. To prevent this, we should use lower energy and thinner skin patients and keep the cartridge perpendicular with complete contact on the skin. Another example of striations here on the forehead. And here you can see a blister on the neck, courtesy of Dr. Kim Bong-chul in Korea. And in patients who have less subzygoma fat, I think you have to be very careful when using the 4.5 and 3 ml. I emphasized this before. This could be more of an Asian concern, as some Asian patients do not like the hollowed look on the cheeks, whereas in other cultures, this actually might be more desirable. Some common causes of side effects are inadequate contact with the skin. This can be caused by having air pockets in the gel from having too much gel or due to the gel type. Some say Parker gel is better. I use Parker gel. I don't know. Inverting the transducer, especially in the submandibular area with poor visualization, can be a risk. So when the patient is lying down and you're using the transducer under the neck, and this is inverted and you can't really see the contact surface, there might be poor contact. And also when treating curved or bony areas like the forehead and the zygoma, it's common to have poor contact. Make sure you shorten the line length accordingly. And then there's stacking, which can happen when you're rushing, trying to go too fast or using too fast of a repeat time in the continuous zone. You might fire on the same area, the same time, 2 times. And higher energy and narrow space interval can also increase the risk of side effects. So we're at the end of the presentation. Sorry for being so long. Some practical tips during consultations: have visual aids, slides, anything you can to use to explain and manage the expectations before the patient decides to do the HIFU. Have a detailed informed consent prepared to be signed before the treatment, and plan the parameters somewhat before you go in. It's hard to do it on the fly. A lot of things are happening, a lot of things you have to take care of, and there's a lot of different cartridges. Sometimes, I always have all my cartridges out before I start the treatment. And you have to really have a plan before you go in, which cartridge you're going to use, at what parameters you're going to start out with, and make sure the cartridges are full with water. There's actually a small opening here, which you can open and fill with water. When you buy a cartridge, it comes with 3 bottles of water that you use to fill it with. So make sure they're full. Make sure you have adequate time and patience for the procedure. If you rush, it's going to lead to some problems. Immediately before starting, in the erect position, discuss and ask the patient again about areas they're concerned about. What you see as a concern area might not be their area of concern. Assess their sagging areas, talk with them, and if you need, mark with a pencil, because when you lie down, the area might not be as visible as when they're erect. Try not to use a pillow, at least for the neck area. Otherwise, you're going to have very little visualization and access to the submandibular area. I think it's important to train your assistants very well to record the settings and lines for each area. I don't know if you're doing it and then recording at the same time, but when you have gel on your hand, that's not easy. I think this is important for later reference to have consistent and better improved results at subsequent sessions, hopefully, and the patient should come back for repeated treatments later on at intervals. So, if they had excellent results, you can use the same results or maybe try and improve a little bit. If the patient had some side effects, then you know how much you need to reduce. So having an accurate record of the energy you use, the number of lines, the areas you treated, things like that, I think you should try and record meticulously. Explain before you're doing each step. Tell them you're going deep. Tell them to expect some pain in their certain areas when you're going deeper. I always start with the lower setting. And you can always increase the power as you go along during that session or at the subsequent session. For the dot, keep the length of line at the default 25 millimeters, unless on the curved surfaces like the zygoma and forehead. And remember that when you're firing, there's an arrow. There's an arrow on the cartridge. This is where the measurement starts. It's not from this side, but from this side. So remember that if it's 5 mm, 10 mm, 15 mm, it's going from this side. Sorry, you can't see it that well. Okay. Keep the interval space pitch at 1.5 mm. If you decrease that, you have to be cautious about the energy level you're at, not only for pain, but for side effects. I use a 4.5 mm only for patients with more fat in the areas. Always do a test shot first. You never know the pain threshold of the patient, and the pain will intensify as you proceed. Usually, I tell the patient, I'm not going to talk with you because they might think that you're not friendly or something, but I tell them that, to have accurate contact and for a safe procedure, I'm not going to talk with you a lot. It's going to be very minimal. If you have a patient who's very talkative and they're moving and talking at the same time, you're going to have a very difficult time having accurate placement during the procedure, and that can lead to some side effects. And when you're using the continuous mode that fires, as you press the trigger, it will continues to fire. You can set the interval between each shot. Don't be overconfident. Stay home driving. On the neck, if you don't put enough pressure, you're gonna have poor contact and easily get striations. If you put too much pressure, the patient will cough or have discomfort breathing. So you have to practice and have adequate pressure on the neck. And to have more effective results, you have to have shorter distances between the lines, but you have to be sure you don't stack. And before you go to bony areas like the mandibular area, the zygoma areas, make sure you warn them that it's going to be a bit more painful, especially if you're going to do the 4.5 mm. Don't be afraid to move the patient's head and neck to get proper positioning. That's better than having a complication. And after you treat an area and you move on, look back on the treated area and see how much erythema is there. That way you'll be able to gauge the settings as you move on. If you're doing a second pass, usually I'll do the first pass and come back after treating the other side. If the patient has crowns or sensitive teeth, you can insert some gauze in the mouth or have them blow a bubble of air. This is a trick that Dr. Lee Jae-hyuk in Korea taught me. So it's like, I don't know how to say that in English, but blow like a bubble of air and fire on top of that, and that can reduce the pain. And be careful, when you have slippery hands due to the gel. So make sure you dry your hands if they're too slippery. For the linear cartridges, determine the areas to treat with the linear HIFU before you go on. Remember, you might have like 8, 9, 10 cartridges at your disposal that you have to choose from. You have to have a plan before you go in, okay, which linear, which dot, where, how much that you're going in. The length of the line is non-adjustable. It's always 25 mm, so remember that. Only treat on flat areas. Avoid the curved areas like the forehead and the zygoma. For the 4.5 linear, it's mostly for areas needing fat reduction. For the 3 mm linear, use lower energy for tightening, higher energy for lipolysis. For 2 mm linear, areas needing more bulk heating for tightening, pigmentations, and flushing. And always start at a lower power and increase later. It's much faster, so when you're using the continuous mode, you have to be much more careful about stacking, and you have to warn the patient about possible shock or sudden pain in certain areas. In summary, HIFU is a non-invasive, no downtime procedure. It's colorblind. All skin types are applicable, so that's great for countries like Singapore where we have all types of ethnicities. It addresses the sagging skin concerns of patients, and now due to the linear cartridges, we can also address excessive fat areas, pigmentations, and flushing. The Ultrasound Q Plus is less painful. It accommodates for busy modern lifestyles, less time in the clinic. It's a faster procedure time. There's no foreign body insertion, and we can get natural results. So last slide. Manage expectations. Customize, be OCD during the treatment, document meticulously, and always it's better to be safe than sorry. Thank you for your attention and for listening. And I'll hand it over back to, this is my Instagram. So this is our clinic, my clinic Instagram. This is my personal one. So if you have Instagram, follow me. I put it as private because I've been having a lot of fake accounts lately. So please, you can follow me. You can contact me through DM or through my email, and I'll be happy to discuss more about this. Okay, so let me stop sharing.
Okay. Okay, can we go start? Yeah, can we start? Dr. Mark Kim?
Yes, please, go ahead. Anyone, if you have questions or comments, please leave them.
Number 1, can you please explain in detail the differences between dot and linear technology and why important to use the both technology? Thank you.
Well, I explained earlier about the linear and the dot technology, about how they're different and the energy, the area that's covered is different. I think that they have different advantages. Even each linear cartridge, the 4.5, the 3, the 2, they each have their own advantages. So when we're looking for holistic or overall improvement of the face and the neck, I think it's important to use a variety of cartridges. So when I do the HIFU, most of the time I use all of the cartridges to some extent. They each can give, some can give tightening, some can give some brightening, and we have to address each of the different layers. So I think it's important to use both the dot and the linear as much as possible in your treatment.
Okay, number 2. Hello, Dr. Kim. Is that possible that linear 2.0 millimeter may worsen the rosacea and flushing in certain patients? And if yes, how can we prevent it for this kind of the patient? Thank you.
Well, I think it's still a little bit early to know the extent. I think we're still very early in knowing how the 2.0 linear cartridge can help rosacea patients and the side effects possible. That's why I think we still have to be cautious in using the linear, and you have to use your clinical judgment first of all. If the patient has severe rosacea or sensitive skin, you have to decide whether this patient can do HIFU in the first place. It's not only about whether this patient can do 2.0 millimeter, but whether HIFU itself is suitable for this patient. If you do feel that the patient is suitable for HIFU treatment, then of course you have to go into each cartridge and how you're using it. When you use the 2mm, you have to be, I would start at a lower power, maybe at a 0.1 or 0.2. That's usually the starting point for patients with rosacea that I use at. There's no need to go very high in the settings, and then you increase the risk of getting side effects. So I think that you have to be cautious. There's still no definite protocol, and there's not a lot of substantial evidence published about how the 2mm linear can help with rosacea and flushing. So we still have to be cautious in using it.
Okay, thank you for answering. And there's a 3 to 4 questions more. Is it okay?
Sure, no problem. Go ahead.
Okay. What about fibrosis as a side effect of the procedure?
Fibrosis. Wow. I've never come across that. I mean, neocollagenesis to some extent is a part of the wound healing inflammatory response. So there is some form of wound healing. You know, we're destroying, denaturing the collagen fibers for them to form again. So it is actually a bit of a scar tissue that we're forming, but in the sense of developing a problematic fibrosis or scar inside the soft tissue, maybe is what you're talking about. I've never come across. I think to cause something like that, you would have to have a severe injury to the tissue, and that would happen at very high settings that are not recommended. So I don't think you have to worry too much about that, but you should not be too much out of the safe range of the settings that you use for the treatment. So I don't think you should worry too much about the fibrosis unless you have a blister, you have an ulcer like we saw on those severe complications in the paper. Unless you have something like that, I don't think fibrosis in the soft tissue should be much of a problem.
Okay. Hello, Dr. Kim. Did doctor have an experience in using 2.0 millimeter linear cartridge on the dark eye circles?
Yeah. I mean, dark eye circles is our nemesis. As we all know, we still don't know the definite etiology of dark eye circles. There's a wide range of etiologies for dark eye circles. There's different types of dark eye circles. And so proper assessment is important, of course, as you know. Does the patient have fat prolapse? Is there volume depletion? Is it pigmentation? Is it thinning of the skin with underlying blood vessels that are more visible? There's a lot of different causes for it. So another thing that I mentioned earlier is that we have to be careful about firing over the eye itself. So we can only fire to a certain extent by pulling the skin down and make sure we're on bone to be safe. The location that we can treat, the area we can treat we're limited to some extent, and also to what the 2mm transducer can help. So we know that it can help to stimulate collagen. So in patients where there's thinning of the skin, it can help with that. If the location of their problem is in an area where we can treat. But if the problem that they're experiencing is more closer to the eye where we cannot even go with the transducer, then there's definitely no possibility that what we're doing can help them. Another thing it can help with, of course, it can reduce some pigmentation. So in that sense, the 2mm linear can help. But again, with the 2mm linear is longer than the 2mm dot. So wait. Yep. So this is not the 2 mm, sorry. So for the 2 mm dot, it's shorter, and that one we can go closer, but with the 2 mm linear, it's very hard to go very close to the eye. So with dark eye circles, to some extent, yes, it can help using the dot. With the 2 mm linear, go as close as you can while being safe. But personally, I use polynucleotide or Rejuven a lot for dark eye circles.
Okay, thank you for the answering. And wow, questions are unloading so fast actually now.
It's okay.
Okay, one more. Yeah. Can it be combined with a lipolysis injection for the double chin treatment in same day? Which one comes first?
Well, like I explained earlier, in our country, we're not allowed to do lipolysis injections. So there are some papers where they use tumescent or normal saline to inject before doing the HIFU. So I guess one of the things you can consider doing is to inject first and then do the HIFU. But personally, I don't have any experience using the lipolysis injections.
I think gonna be the last questions. Can we use only linear cartridge and achieve the same result for indication of the dot cartridges?
That's a good question. I've only used the linear solely alone for patients who have double chin or who want fat reduction in certain areas. Because as I explained earlier, it's not only about the heat that is produced that can stimulate collagen. There can still be collagen stimulation through acoustic cavitation, which can be produced also, and mostly is produced by the linear cartridges also. I think that still has to be researched and looked into. But definitely, I think that even just by using the linear cartridges alone, you can achieve the tightening effects that some of the dot cartridges can give you. So, for example, if I use a linear cartridge or dot cartridge in one area, I don't use the other type of cartridge at the same depth in the same area. So, for example, if I do a 4.5 linear in this area for the jawline, I won't do the 4.5 dot. The 4.5 linear is already done. I feel it's done its job enough. So then I'll just move on to the 3 mm. Yeah, so I think that, the linear can provide, I think, similar results with additional effects that I explained earlier about fat lipolysis or pigmentation, reduction of rosacea. But still, the traditional and the published data is still based on the dot technology. So that still is, I think, where the basis and foundation of our treatment should be. And then on top of that, using the linear transducers.
Okay, thank you for everything. Okay, thank you. We have finished now. If you have any further questions about the today webinar and our devices, Ultrasound Q+, please send us the email. And I provide you the answer of some questions which was not mentioned from the Dr. Michael Kim today. And one more, please attend our survey after they finish the webinar. And do you want to say something to everyone?
I just want to thank every single one of you for attending today. It's been really exciting being, unfortunate that we're not able to meet in person. I hope that soon we will be able to meet in person, but this does allow us to connect easier all around the world. And I think that there's really a lot more for us to research and learn about HIFU and about linear HIFU. So hopefully we'll be able to share our experiences and our knowledge in the future. So definitely email me, contact me on Instagram, and hope we can continue our discussion moving forward so we can help our patients achieve more natural, better, safe, effective results. So thanks everyone. Have a good night or a good day wherever you might be, and hope to see you soon.
Okay, thank you again for attending this Ultrasound Q+ webinar.
Longer treatment of ultrasound can stimulate the differentiation of fibrocytes into fibroblasts. This is a study done showing the effects of LDM ultrasound on HSP or heat shock protein expression, and it shows significant increase after exposure to ultrasound energy and postulated the mechanism to be the pressure gradient. Again, this is a physical, not a biochemical etiology over the cell membrane, influencing the cell shape and cytoskeleton. Heat shock proteins are a family of proteins that are produced by cells in response to exposure to stressful conditions, and they're thought to be involved in various signal transduction processes. Activation of the heat shock response via HSPs normally results in cytoprotection, and they were found to be suppressed in aging skin and diabetes patients. Ultrasound can also create movement of fluids along cell membrane boundaries via oscillations of mechanical pressure in tissue. This is called acoustic microstreaming. And this can alter the membrane structure, function, and permeability of cell membranes and even the extracellular matrix. In this article from 2012, they showed that cells produce significantly more collagen and GAGs after ultrasound exposure. And the upper picture is the control, with the lower picture here showing more GAGs surrounding the cells exposed to ultrasound. Just last April, a paper on ECM rigidity, which is closely related to how skin boosters like Rejuvenation or polynucleotides function and its effect on sonoporation. And it focuses on the microbubble dynamics. On the left, you can see the different types of microbubbles and their interaction with the cell membrane. And they used a high-speed camera to measure the microbubble sizes and dynamics in soft and rigid ECM environments. To me, this was a real eye-opener in the sense that I didn't know there were these types of different interactions happening on the cellular level during ultrasound treatments. And seeing how substrate rigidity can influence the ultrasound bubble mechanics, it opens up so many more questions and possibilities when it comes to combination treatments with HIFU. And this article concluded and emphasized the need to understand physical mechanisms, especially cavitation in HIFU and ultrasound treatments. They gave the example of lithotripsy and stating the avoidance of cavitation effects on tissue is probably why there's been little change or breakthrough in HIFU treatments. That is until now that we have linear HIFU available. And the reason for me sharing all of this up to now is to convey that there's so much more than just the thermal heat from HIFU that is going on in the tissue. What has been the major breakthroughs in HIFU technology and HIFU clinical effects over the last years? Patient expectations have been growing exponentially, but our HIFU technology has been stagnant. There's more to HIFU energy, especially in the acoustic cavitation realm, but maybe we're just ignoring it because, well, it's very complicated and difficult to understand. So I apologize for the lengthy prelude, but because some may say there is little evidence published on linear HIFU, I wanted to present some background on the potential that linear HIFU energy possesses to improve the areas treated through acoustic cavitation and nonlinear absorption. These are two books that some of the information that I shared just now is from, and I'm still studying them, but it's not easy. I hope that we can study more together in this field and discover more breakthroughs for HIFU treatments in the future. On to HIFU. We all know what HIFU is, high intensity focused ultrasound, and I'm sure you know a lot about the mechanism and how it works already. And we've seen this slides too many times, so I'm just going to skip this. After HIFU, we know that the intensity zones of heat initiate wound healing processes in those areas. And there are two different types of HIFU energy delivery modes. But until now, we have only had the first mode to use in our practice, sequential discrete modes. Is a type of HIFU we're all familiar with. When the HIFU fires a series of separate TCPs, whereas a continuous scanning mode fires energy in a predetermined trajectory. So for ease of communication, I'll refer to them as dot and linear HIFU. For myself, I did not even know there was this type of scanning HIFU energy, and I also thought that it was a very recent development, but doing some studying, as you can see here, even in the early 80s, 1980s, there were papers on this type of linear ultrasound energy. Here on the left is the dot type HIFU we know about, and on the right is the linear type of HIFU. And actually for some time, we've had this linear HIFU for body lipolysis, but as many will know, it's very painful. So we need to balance the effectiveness with the pain level and side effects. Now, this is a very important paper that I feel forms a basis of understanding the two different types of HIFU energy and how they differ. Now, this slide refers to the dot HIFU. This is the x-axis, and this is the z-axis. The z-axis meaning we're looking at it from above. So we're looking at the width. In dot HIFU, as the interval space is decreased as we go this way, the width increases and starts to overlap. So you can see that there is a fluctuation here in the peak temperature, and this suggests more interaction between points when the interval space becomes smaller. So you can achieve smoother lesion boundaries by reducing the interval space, but you will experience higher peak temperature and more fluctuation. Now, this is linear HIFU. This shows the difference in lesions when the speed increases. You can see the smooth boundaries along the scanning path and reduced fluctuations in the temperature profile